All right, guys, today we will be covering dobutamine. Once again, this will just be another basic overview. Hopefully, it gives you a little bit of a better understanding, maybe why your patient's on this drip or why you see so many of your patients that are requiring dobutamine. So, we will get right into it. First thing we'll start with here is just what it is. Okay, so dobutamine is classified as a positive inotrope. What this means is, being an inotrope, this means it's going to cause increase in the heart's contractility. Heart's contractility. So all that means, it really just indicates a stronger squeeze. So it's going to get a better ejection of blood out of that left ventricle. So that's going to help with improving your cardiac output. That's why you see this a lot for patients with heart failure, or maybe they're in cardiogenic shock. As far as the receptor that dobutamine works on, so dobutamine is primarily a beta-1 agonist. So with beta-1, what you see here, so when beta-1 is activated, once again, you'll see an increase in heart rate and an increase in that contractility that we just talked about. So if you remember here, remember cardiac output is going to equal heart rate times stroke volume. So by increasing your heart rate and the contractility, which is going to increase the stroke volume, better ejection of blood, that's how you will get your improved cardiac output there. As far as some indications for why, let's use red here. As far as some indications for why dobutamine is used, primarily and probably the most common is going to be heart failure. And we'll just do / cardiogenic shock. Remember, cardiogenic shock is just a progression of heart failure, right? So cardiogenic shock, like we talked about earlier, so the issue with heart failure is you get inhibited forward flow of blood, right? Blood starts to pool, starts to work backwards, so you need something to push that blood forward. So that's how you get that increased contractility. So that's that beta-1 agonist again. Leads to increased heart rate plus increased contractility. And this is going to lead to basically improved forward flow of blood, which is going to lead to increased cardiac output. You'll see some patients that maybe it's like a bridge to transplant. So maybe transplant patients that get to go home, they may be on some home dobutamine. It's a heart transplant. Sorry, I should have clarified. This is heart transplant patients may go home on home dobutamine there. You could also see this sometimes used in sepsis. It can be used in sepsis if signs of hypoperfusion still are persisting, maybe even after you've corrected the blood pressure with vasopressors as well. So those are your most common indications. As far as dosing, you will typically see dobutamine dose 2 to 10 mics per kilo per minute, and this is typically going to be a fixed rate, so something ordered by the provider. You'll be drawing labs, you'll be trending things like your SVO2 and your lactic acid there, so they might make adjustments, maybe higher or lower, depending on some results of those values as well. As far as things to monitor for, we will go here. So some side effects / things to monitor for. Big ones here are going to be tachyarrhythmias. So this is, you'll see this, once again, due to that beta-1 activation, it's going to cause that increased heart rate, right? So you'll get kind of increase in your heart's excitability. So you might see like little runs of VTAC or just increase in heart rate in general. So especially when you're just starting it, I'm going to be careful of that, especially if they're already a little tachycardic. Kind of along the same lines with tachyarrhythmias is palpitations. Could also potentially see headaches as well. The last one, this one's a little more rare, I believe. It's actually hypotension. And this is going to be actually due to, so we talked about beta-1 activation, but the hypotension is actually due to, it has beta-2 activation as well. It is minimal. So minimal beta-2 activation, and beta-2 actually causes vasodilation. So especially when you're just now initiating like a Dobutamine drip, you want to make sure you're going to keep a close eye on their blood pressure, which you'll be doing at all times in the ICU anyways. That's something to be aware of. Typically you'll see your blood pressure will more than likely probably increase a little bit as a result of hopefully increasing that cardiac output. But yeah, that's just a quick basic overview there of Dobutamine. You got the receptor, so it's beta-1 agonist, most likely use heart failure, cardiogenic shock, dose be 2 to 10 mics per kilo per minute, and you're going to monitor most likely for tachyarrhythmias and things like palpitations. So if you liked the video, you learned anything, please subscribe, and we will see you in the next video. Thank y'all.